The following program is an original production of WICC PBS Chicago.
Good evening. I'm Chris Bury. Welcome to a special presentation of In the Loop.
And I'm Barbara Pinto. Heroin is making a deadly comeback, invading the city and Chicago's suburbs.
The human cost is staggering. Overdose deaths, broken families, destroyed dreams, rising crime. Tonight, we explore this growing epidemic.
Mostly A student. I was in the AP classes, honor roll, all that stuff.
27-year-old Bill Patrianakos grew up like most kids in southwest suburban Homer Glen. He had a small, loving family and big dreams.
I was accepted to Loyola, and I went there for a year. I was going to become a doctor. I was in the pre-med program, but I also became a heroin addict too.
Bill says he got high nearly every single day for 5 years. First, a few pills he found around the house to self-medicate his depression, then marijuana and cocaine. When the pills got too expensive, he moved on to heroin.
I went online and I looked for where everyone was getting arrested for heroin, and I drove straight there. And it took me about 20 minutes to find a guy who was willing to sell to me.
That place, Chicago's West Side, right off the Eisenhower Expressway, at almost every exit between Harlem and the Loop, a stretch known by addicts and police officers as the heroin highway.
It's like a candy store.
Clean and sober for about 6 years now, Bill works as a web developer and sits on the board of an organization called HERO, or Heroin Epidemic Relief Organization. Two suburban fathers, John Roberts and Brian Kirk, founded the group after both losing sons to heroin.
We have all the evidence to prove that this is a serious epidemic, and it's an epidemic that's aimed right at our children.
Heroin is the next health crisis in this country.
Kathleen Burke is the former CEO at the Robert Crown Center for Health Education. The center works with suburban schools to educate students about the dangers of heroin. Burke says just say no doesn't work with teens. They want the truth.
We tell them now, you're high. When you start using heroin, it's really pleasant. You know, it's a high that you want to chase the rest of your life.
And that's the problem. Kathleen says the drug is toxic and sinister.
It changes your brain. It changes the way in which your brain functions, and it keeps you craving the drug. Even if you've been through rehab, you continually crave that drug.
The Robert Crown Center uses an animated presentation as part of its effort to reach young people. Bill says teens need to hear the whole story, the pleasure and the pain associated with drug use.
Right now, health education is about scaring you into not doing it. Not being honest with the kids in terms of telling them, yeah, you know what, drugs do feel good. That's why people do them.
In hard-hit DuPage County, 46 deaths were attributed to heroin overdoses last year. Law enforcement officers educate teens and parents while cracking down on dealers and users. Last fall, they helped make dozens of arrests in a heroin ring allegedly led by a Chicago man whose underlings delivered the drugs to DuPage County. This evening, we're joined by 3 guests with deep knowledge of the war on drugs and this drug in particular. James Glasgow, State's Attorney for Will County, Dr. Candace Norcott, Director of Behavior Science at Loyola University, and John Roberts, co-founder of HERO, which stands for Heroin Epidemic Relief Organization. Thank you for joining us.
You're welcome.
We've heard so much about the Sinaloa cartel's direct link as the heroin pipeline to Chicago and the arrest recently of El Chapo, the head of that cartel. Jim, has that had any impact on the amount of drugs flowing into the Chicago area?
No, and it won't, because someone else will pick up where he left off. Now, he was given credit for the fact that he was able to bribe half of the Mexican government and create this new pipeline. They improved the quality of the drugs by getting the Colombian chemists to come in, and that's why the purity is so high and has made it so deadly that we've seen the spike in the overdoses. But in Will County in 2009, when I met John Roberts, and he began the plan to form the HERO organization, that combined with our HELPS organization from the health department, we've had a very strong effort in both prevention and prosecution. And I saw my conviction on drug dealers go from 14 in 2009 to 50 in 2012, but only 14 last year. So we've pretty much on the street sent the word and eradicated the bulk of our dealers. But as you were as the public service said, you can drive up to Chicago on the Heroin Highway and get it at the snap of a finger. That's the real problem. And you know, John is back in law enforcement now, and he and I need to put our heads together about how we can get with Cook County and get the collar counties to get a unified task force and go after the Heroin Highway.
John, you're in law enforcement now, but you're also a parent who has lost a child to heroin. Are you shocked at the sheer numbers of overdoses, as we heard in the opening piece?
Chris, I'm not only shocked, I'm scared. I mean, I have 42 years in law enforcement. I've never seen anything grow so quickly, spread so quickly. When we first started our organization, I insisted on the word epidemic being included in it. My research showed me that it was going to spiral out of control, and in fact it has. And it's not just urban Chicago, suburban, it's now the hinterland. I'll be out in some rural communities this month because heroin is now out, and I'll be in Streator, Illinois, and in Minooka. I mean, the thought that it could spread that far, that fast. Now that's just this region. Hero has been contacted by families from now up to 15 states asking, how can you help us start an organization like Hero in our community? This is nothing less than an epidemic. So again, surprised, no, shocked, stunned, and scared at how bad this epidemic is growing.
It seems to be getting attention now at the highest levels of government. Let's hear from the U.S. Attorney General, Eric Holder.
When confronting the problem of substance abuse, it makes sense to focus attention on the most dangerous types of drugs. And right now, fewer substances are more lethal than prescription opiates and heroin.
And Dr. Norcott, Chicago, the Chicago area, leads the nation now in emergency room visits because of heroin overdoses. Why Chicago?
Why Chicago? Why not, I think is the question. I think any place is susceptible to addiction and to drugs, and so that's the part really that we should focus on is what are the risk factors? Certainly trauma, depression, comorbid mental illness. We know that we're closing down facilities, especially in Chicago and Illinois at a record rate. And so there are going to be people that are searching to self-medicate, searching to use substances to alleviate pain, and heroin does it very well. And this can be a really great opportunity to start focusing on some of those issues, using heroin as a conduit really to talk about what are the issues that push people into substance abuse and wanting to escape.
One of those issues may be prescription drugs. We've seen a lot of attention given to the overprescription of opiate prescription drugs. From your perspective, Jim, is that the gateway?
It can be, and that's where parents have to be vigilant, that when they have opiate prescriptions in their home, to make sure that they're not available to their children. But again, as we've talked, you can drive up to Chicago and for $100 get 13 jabs. And many times they'll give you some bonus ones to get you to come back. So it's so readily available. And you know, the overdoses is what really caught everyone's attention back in '09, because we hit 29 in Will County, and we had normally been in the low teens or single digits prior to that. And that peaked at 53 in 2013. But last year we dropped to 35, which is a credit to John and his work. And you know, John can tell you, we hit the schools, we hit the parent organizations, we spoke to them, we let parents know what was going on, and I think that's directly attributable to that drop. Additionally, you know, the drug dealers that we removed from the streets, but we still have the major problem up in Chicago where the stuff is just available anytime you want it.
Well, how easy is it to get it, John? I mean, if you are a kid from the suburbs, how simple is it to get heroin at a relatively cheap price?
In spite of all the good work being done by Chicago, the DEA, and law enforcement in Chicago, there remains, at the last count I heard, is like 170 open-air drug markets. So suburban kids can drive in along Heroin Highway, pull off of the Eisenhower Expressway 290, and go less than a half a mile from the expressway exit, and just look for people standing on the corners, and they're easy to spot. We could go out there right now and find
the cops
several.
can't shut these down, or as soon as they shut them down, they keep popping back up again, like whack-a-mole.
Chris, I was at a summit last year at Moraine Valley, and it was delightful. The chief from Lamont, Kevin Shaughnessy, brought together 3 sitting state's attorneys, including Jim Glasgow, Anita Alvarez, and Bob Berlin from DuPage, and 250 law enforcement executives from around the region. And it was delightful to see, but there was a speaker who said how they had shut down 20 to 30 of the open-air drug markets on the west side of Chicago, and I was just delighted. And when he came up the stage, I approached him and thanked him, and I said, now keep at it because you have 170 more to go. The day that, until we can drive them off the corners so that a suburban kid can't just pull up and get curb service, it's going to continue. And we have to work together to fight for that, to bring them down.
And also to speak to your point as well, we know that about 80% of people that are of heroin users started off with prescription drugs, but they weren't prescribed to them. So, I mean, and knowing that is an opportunity to educate people about how to dispose of drugs that you're not using, prescription drugs, prescription opiates. Primary care facilities can be a place where people can come and bring old prescriptions, and really educating people about how to dispose of them.
Why has it become so lethal? You know, we saw in DuPage County, for example, more than 40 deaths in this suburban county in 2012. What's made it more lethal?
Well, one reason is that people don't know that a lot of the overdoses are in conjunction with a sedative or alcohol, and so people will use opiates with alcohol and not really know how lethal that can be. So getting that information to people as well can make a difference.
The other thing is the purity. It is skyrocketed. It's over 50% pure in some places, whereas in the old days, if it was 7% pure, the addicts were ecstatic. The other thing is the availability at parties. The kids in Will County came up with this tagline that if you snort it and you smoke it, you're not an addict, only if you shoot it. Well, that's absurd. Once the opiates get into your system, it changes the chemical balance in your brain, and you start to be, the craving starts. And as John always says, you're chasing the dragon. That first high is always the pinnacle, and then you never can quite get it back. Now your body's dependent on it. When you don't have it, you feel terrible. So you're constantly seeking it. It's a vicious cycle. We've seen in my drug court that I started in 1999, we have seen a switch, 80% cocaine, 20% heroin, 80% heroin, 20% cocaine in the last 5 years.
Completely reversed.
Completely reversed.
Price driven?
Price driven, and availability, ease of use, and sadly, initially at least, the kids were not scared by the potential death. But I think, as we've seen a recent drop, we're hoping that prevention message got out there, and there is that clicking in, that other people, and then we're also prosecuting drug-induced homicides, where if you provide heroin to another person and they die, and we can prove it, we're going to come through with an indictment, and that, I think, hopefully will have a deterrent effect.
Clearly, the scope of this problem is sweeping. Chicago Police Superintendent Gary McCarthy heads up one of the largest police departments in the country, but even he has admitted that this is beyond his reach.
I don't think that law enforcement is going to fix the narcotics problem in this country. And many people would say that's blasphemy, but I think it's reality.
We heard him say law enforcement can't fix this alone. Do you believe you can arrest your way out of this problem, Jim?
No, you can't, and that's why the parents are critical. I've got 5 children, ages 13 to 37, and I've been blessed, to the best of my knowledge, none of them have dabbled in drugs. And but again, that's reinforcement at home, vigilance. Your child's room is not a private area. If you want to go in there and search their room, you're doing them a favor. And when kids say, "Oh, you can't look at my iPhone," or "You can't do," no. You provide it, you own it. You need to check and make sure. If he's got drug dealers on his phone, you need to know, you can save the person's life, the child's life. So be vigilant as a parent. When they come home late at night, give them a hug, take an inhale. See if you smell marijuana, see if you smell anything unusual. Look at their eyes, listen to the way they talk. My wife knows the day before my kids lie that they're going to lie and what they're going to lie about. It's that sixth sense that parents need to have in order to protect their children. And if you're vigilant, you can do it.
Dr. Norcott, if even the chief of the Chicago Police Department says he can't arrest his way out of this, what is the right direction for people in authority to take?
And that is wonderful to hear, the kind of the change in approach to take away the criminalization of using drugs around the drug industry, because what we see is that adolescence is really the time of highest risk, and often adolescence and the symptoms of adolescence, if you want to say that, can mimic early drug use. You know, isolation, mood, lability, and so there really is a lot of opportunity of interventions with adolescents. I think it's also marked by teenagers being their most powerful influence, right? It kind of goes from parents in the early ages to teenagers in their social group being really having a high influence on each other, and asking them who would they like to get drug information from, or what's the best way, kind of having this conversation with schools, using places that they congregate naturally as a way to get accurate drug information to them, accurate information about addiction and dependence. NIDA just came out with a report that I want to urge all parents to go to.
Who's NIDA? NIDA,
National Institute of Drug Abuse, came out with a report that I think parents should read and talk and learn more about how adolescents are using drugs, and we know more now about treatment for adolescents that can be really helpful. And an interesting piece of information that is part of that larger report is that teens that abuse and people that abuse opiates start around 14. So if you start using inhalants early, age 14, you're at higher risk for being addicted to opiates later. So we see a lot of overlap with drug use.
That is so young when you think about a 14-year-old.
A lot of the research starts at 12.
12 years.
Can I add you use one of my favorite quotes, "We can't arrest our way out of this problem." That's Gil Kulikowski, the federal drug czar, Office of National Drug Control Policy. Superintendent McCarthy, and you are quoting him. He's one of my heroes. He's a former police chief from the Northeast. And at the federal level, and the White House drug control policy is magnificent. I mean, after 42 years, I've learned we cannot arrest our way out. It's more than a crime. It's a complex social phenomenon. It's a health crisis. We're only going to, in fact, Gil Kulikowski doesn't even like refer to the drug war anymore. I mean, we're taking casualties. Well, we should be looking at it as health providers, mental health, medical health, police. I mean, it has to be a combined, comprehensive approach that we take. We should be looking, instead of a casualty count, recovery count. We should be finding ways to help those who are becoming infected by this disease, and then prosecuting fully those who are selling the poison that originally affected them.
But is that distinction a correct distinction to make between the seller and the user? I mean, is it fair to crack down on the seller and distinguish him or her from the user? Because in many cases, aren't they the same, Doctor? There's
a lot of overlap, and certainly a lot of people that get into selling to support a habit that's gotten out of control. I think to have a hard line and act like it's a black and white issue I think is flawed.
But one of the things in law enforcement that I have to be aware of, if you sell marijuana, even cocaine, the potential for death is minimal. With this heroin, if you're at a party and you're drinking and your thought processes are, skewed, you see a line of white powder on a mirror and other people are snorting it. You snort it, it could be fatal. Your body isn't used to it. That could contain sufficient opiates in there to shut down your respiratory system, and you're dead. And that's why, and again, in 2013, we had it happen 53 times. We had overdoses, probably between 200 and 300, where the paramedics saved the overdose victim with the naloxone or Narcan, which we're working on a program in Will County right now to arm every police officer with this nasal spray that will allow them. Many times they beat the paramedics to the scene by 5-10 minutes. Those minutes can be critical. And so we're hopeful that all of the departments will embrace this. A number of them have already, and we'll have that online very soon.
And other counties and other departments are also taking new and different approaches. We want to hear now from the DuPage County State's Attorney, Robert Berlin.
The heroin today is 10 times more powerful than it was in the 60s. And it's easy to use. You don't have to inject it anymore, which is why so many people have gotten attracted to it. You can smoke it and you can snort it, but because it's so powerful, it's killing people.
And that goes to your point, but in DuPage County, they have decided not to lock up the heroin users. I mean, they will prosecute them with a felony, but they're not putting them in prison. And John, what do you think? Is that a good approach?
You know, Jim schooled me on drug court. And, you know, we've tried to, okay, well, we'll rust our way out of this problem. And, you know, if you have somebody who's experimenting with drugs, half of all of our high school students will before they get out of senior year. So how about if we educate them before they get to that point of experimentation, and then if they make the mistake of possessing a drug and arrested for it, let's get them in the drug court. Let's, you know, intensify our efforts to turn them away. I mean, diversion from our criminal justice system is always going to be a great idea. It's far less expensive. And, you know, if an addict is once they become addicted and they get out of prison, they're largely, most often will go back to that addiction and possession of the drug. If early on we intervene and we turn these youngsters away from it through education and prevention, it's the best of all worlds. It will free up, you know, it's so costly, $22,000 to $30,000 a year for an inmate. You know, spend that money on treatment, especially with youthful offenders. Get them out of the system forever. Don't bring them back several times. They are going to relapse on heroin. And if every time we lock them up and throw them into prison only to relapse again, we're throwing good money after bad. I would rather see, and that's what we can't arrest our way out of this. Let's look at prevention and education as the ally that law enforcement has actually needed for 30 years. We desperately need help.
You talk about treatment and relapse. Candace, how difficult is it to get someone off heroin for a long period of time, and why is this drug so difficult to kick?
It's extremely difficult to get someone off, but people do recover from heroin. And one of the, I think, important things is that in other countries we talk about that they have a harm reduction model, and we're really focused in this country on sobriety. Now, I'm not advocating one or the other, but just to consider a paradigm shift and goals and having the goals be maybe quality of life instead of complete sobriety is one way that other countries are approaching treatment for opiate addiction. And I think that then broadens your scope of recovery. There are lots of pathways that people take to becoming addicted to a substance like heroin, and there will not be one treatment that fits all. We can't have a one-size-fits-all approach to treatment.
But if we don't want to throw people in jail and we want to get them in treatment, Jim, is there enough treatment? I understand there are long waits to get into many of these centers.
Yes, and back in 1999, I wrote a grant for a drug court grant of $500,000. It was a judicial grant, not a prosecutor's grant. And I went to the site visits, and the judges were saying, "What are you doing here?" But I've always had a philosophy of balancing the social costs of what I do. I convict a young person of a felony for possessing drugs. He's unemployable. So even if you're in the Tea Party, you're going to say, that's a bad idea. You're putting that person, they're going to be dependent on everyone else for the rest of their lives. Not to mention the fact that if you want to drive the depression, you know, home to that person, put them in that position, and then tell them not to use drugs, that's foolhardy. So we've had almost a 90% success rate with our drug court since 1999. Only 10% have relapsed. That's really phenomenal. And I even had a young lady named Liz Johnson who went through my drug court in 2000 and came out and went to law school, and I hired her, and she became a prosecutor, and she made the motion to dismiss the criminal cases at one of our graduations. So it just shows that the courts work, and talk about full cycle, and she could certainly stand as a role model for these young people that you can accomplish anything once you graduate from this court.
But are these rehab centers, are there enough of them, and is there access, John?
And how expensive are they?
No, there's not. I mean, I just testified in the State of Illinois building before our legislative committee, budget committee, and one of the other witnesses testified that 88% cut in funding for prevention and education. And I was asked if I would come and testify, and I said, you won't be able to hold me back. But now, more than ever before, with this epidemic, to not have the necessary treatment and prevention to address this epidemic is lunacy. We have to start to, as Candace mentioned, a paradigm shift. We have to start realizing how important that is. If we're ever going to turn this epidemic back, we have to have the prevention in the schools, the education. over the last 4 or 5 years, as those funding cuts hit, more and more institutions closed. My son Billy overdosed. We saved his life. He was transported. He was administered Narcan. He was taken to a hospital. And I tell the story, and I won't mention the hospital's name, but after almost losing my son to a drug overdose, I was handed a list of drug providers and said, okay, here, it's 4 o'clock in the morning on a Saturday. Here, there's the door. Here's your list of local providers, and there's the door. And we have to change that model. But the worst part about it, when I called those numbers the next day and through Sunday and Monday, half of them were closed. So here's a parent who almost lost a child, and I'm left out there alone. I mean, last year, Hero Helps at Lewis University, we had the medical model where we suggested that if you are brought into a hospital, that, okay, save the life, reverse the overdose, and then call in a psychologist or a counselor and speak to the family, speak to the drug addict. If you can, at that point, aim them right at treatment. And then hopefully, with, if the state can find the funding, we have to have more treatment providers, or the death toll and the addiction rate is going to continue to climb.
One of the really sad things is what John just said is, in order to have the benefit of the drug court, you have to get arrested. So if you're just simply in an overdose situation like John was describing, yeah, there's a tremendous gap there, and parents don't know exactly how to proceed once they leave the hospital, which can have devastating effects. We have 2 recovery homes now with our drug court, which helps to finish the treatment. So once we get out of the clinical setting, we've provided our own adjunct to that. So that's what these drugs courts can do, but it does not help the situations that John described where the person hasn't been arrested. And in society, we need to figure out a way to fix that.
And additionally, we have a stereotype of treatment, which is this 28-day model. And to really understand that that came out from the 80s, from what insurance companies would reimburse. That's not anything that's found that 28 days is, the silver bullet for drug addiction. So we really need to revamp how we think about treatment and how we're really going to invest and double down in treatment and prevention with.
How many times does an addict, on average, go through treatment before they maintain some level of sobriety?
Numbers have been thrown out between 6 and 7. But often they'll say 6 and 7 failures. And so people that go through relapse feel like failures, when really to educate that this is a normal part of recovery, relapse, and to understand that to not be punitive to people that relapse and take the stigma and the shame away, I think is also a really important step.
All right, we'll have to leave it there. That wraps up this special presentation of In the Loop. For more information and resources on heroin and addiction services, you can log on to our website, wycc.org, and look for In the Loop. We'd like to thank our guests, James Glasgow, Dr. Candace Norcott, John Roberts. Thank you. I'm Barbara Pinto.
And I'm Chris Bury. Until next week, good night.
Good night.